Reversible loss of vision in malignant hypertension. Definition: malignant hypertension is extremely high blood pressure that develops rapidly and causes some type of organ damage. Usually the damage happens to the kidneys or the eyes. High blood pressure is the main cause of malignant hypertension. Common symptom is bleeding and swelling in the tiny blood vessels in the retina. The retina is a layer of the nerve that line the back of the eye. It sends light and sends signals to the brain through the topic of the optic nerve, which can also be affected by malignant hypertension. When the eye is involved, malignant hypertension can cause change in vision.
Hi, I'm Dr. Narsaraju. All of us have heard about hypertension. What is malignant hypertension? Malignant hypertension is a condition where the blood pressure rises acutely and to very severe levels. Normally, we all know the blood pressure, normal blood pressure is up to 140 by 90. So there are two readings, the systolic and the diastolic. The upper limits of normal are 140 by 90. If the blood pressure rises to more than 180 by 120 acutely and associated with some organ damage, that is called as malignant hypertension. This is a potentially serious and life-threatening condition because it can lead to organ damage, especially sensitive organs like the eyes, brain, and the heart. These are the things that can get affected, producing conditions like a heart failure or an acute pulmonary edema, stroke, coma, and eye damage. So this needs to be recognized and treated as a medical emergency for saving the organs. So this is an important condition that everybody should be aware of, and this needs an immediate medical attention and admission and treatment. The most common cause in general practice for this emergency is stopping of medications. So for God's sake and for the sake of preserving one's heart, one should never skip antihypertensive drugs, that is, the drugs that are given to treat high blood pressure. This is the message I want to give.
Application in medicine. In a malignant hypertension, the blood pressure should be slowly lowered over a period of minutes to hours with an antihypertensive agent. It differs from other complications of hypertension in that it is accompanied by swelling of the optic disc, papilledema, and malignant hypertension.
Now there's a sign for malignant hypertension that is extremely important. Obviously the blood pressure would be high, and indeed the blood pressure is high, and diastolic blood pressures of 120 and more, and systolic blood pressures of 210 and more are compatible and consistent with malignant hypertension. But that is not what defines it to be malignant. What defines it to be malignant is that if you were to look with an ophthalmoscope in the back of the eye, you will notice that there is swelling of the optic nerve disc, a condition we call papilledema, a swelling of the optic nerve head, if you like, the second cranial nerve, because the pressure inside the brain is increased. There is a raised intracranial pressure. And as well as papilledema, you often see exudate and hemorrhages in the background of the eye because of the damage to small blood vessels I've already talked to you about. So you diagnose malignant hypertension not so much with a sphygmomanometer, but with an ophthalmoscope.
Pro and cons. Pros. Prone diagnosis and treatment may restore vision and retinal anatomy without any intervention in the eye. Current tomography is a relatively new imaging technique for evaluating retinal thickness and the location of pathology in patients with malignant implantation. Presence of papilledema and macular exudates are unique features in malignant implantation that could alert physicians to this medical emergency. Cons. Malignant implantation can result in acute, substantial loss of vision owing is ischemic optic neuropathy and severe maculopathy. People of African American ethnicity are at increased risk for developing malignant implantation. Malignant implantation may also cause brain swelling, which can result in hypertensive encephalopathy. Issues in Ecuador. In the country of South America, the prevalence varies from 8 to 30%, placing the true first place for Cuba, Mexico, and Venezuela. Ecuador is behind them with the 29%. These values are increasing with the greater presence of risk factors.
High blood pressure can affect the eyes in multiple different ways. So most commonly, people who have long-term chronic high blood pressure, they develop slow changes where the blood vessels start getting thinner, they start to harden, and then the blood doesn't get to the tissue quite as well, and that does the retina won't work as well. It can cause something called retinal vein occlusion, whereby basically you have a stroke inside the eye that can cause a hemorrhage and vision loss. And then also acutely, if you have a sudden spike in blood pressure for some reason, that can cause swelling of the optic nerve, and that can also cause decreased vision. And in the eye, when we can find these changes, then that is highly suggestive to us that there's changes elsewhere in the body, and that a really thorough exam and coordination with the primary medical care doctor needs to be done.
Conclusion. Malignant hypertension is a serious condition that significantly affects vision in difference from other hypertensive disorders. It is of great medical help in case of emergency. Therefore, we say that it diagnosis and treatment help in good way to restore the vision.